Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, guys. Welcome back. We're so glad you're with us today. Today, we're going to be talking about psychological testing, what it is and when it can be valuable. And we're going to have an amazing guest. Her name is Dr. Lauren Spears, and she is a licensed clinical psychologist specializing in psychological testing and psychoeducational assessment. And so she does these kind of tests all the time. And she has a really deep understanding of neuropsychology, so how our brain works. And that's a really important piece in assessment. So she's going to break down this process and help us to understand if testing is something that would be valuable for ourselves or our kids. With that, let's get to Lauren.
Thank you so much for having me. I'm excited to be here.
Yeah, absolutely. Okay, so let's jump into this. Let's talk about what is psychological testing?
Okay. So psychological testing, or you'll probably hear me say assessments and also psychological evaluation, kind of interchangeably. But it is a process of different procedures that a psychologist might go through to answer a question or address a concern that either a referring provider or a client might have about an individual.
Yeah.
So some examples of that might be like a parent, they're noticing some signs of inattention or impulsivity or hyperactivity in their young child, and they have this question in mind. So is there like a diagnosis there? Might my child have ADHD? So sometimes they'll call me directly and seek out an evaluation, but more often than not they might be referred by another provider. So they might talk to their pediatrician, they might be in conversations with the teacher or the school about these symptoms, and somebody might say, hey, you might want to have an evaluation. And so people find me in different ways.
Yeah. And you guys can answer all kinds of questions, but like the questions that we're looking at is all the things in the DSM, right? Our diagnosing manual are the things that you can diagnose, right?
Correct. Yep. So I'm a clinical psychologist. So that is my diagnostic Bible, so to speak. I am qualified to diagnose anything that might be in that, the DSM-5 TR now.
New revisions all the time. Yeah. And so that
Yeah.
means, I mean, this is just a non-comprehensive list, but like that's anxiety, that's PTSD, that's bipolar, that's ADHD, that's depression, right?
Correct. Yep.
Things like those.
Yeah. So your classic, mental health disorders like anxiety, depression, OCD, PTSD, schizophrenia, bipolar disorder. I have a lot of training with adults and just kind of a generalist population. So I'm also qualified to diagnose personality disorders. But a lot of what I'm diagnosing these days are what we call neurodevelopmental disorders. And those are the disorders like ADHD, autism spectrum disorder, specific learning disorders, and other kind of related disorders that, are based in the brain. They're there from birth, and they affect an individual's development.
Yeah.
Yeah.
Okay. Cool. Perfect. Okay. So why would somebody need psychological testing? We kind of talked about that within the diagnosis, but like what would be the reason that somebody would need to do testing?
So there are a lot of reasons that somebody might seek out an evaluation. Like I said, one of the big ones is diagnostic clarification. So there might be a question that somebody has about whether a diagnosis is present, and we're trying to determine that, or kind of differentiating between possible diagnoses. So sometimes there's certain diagnoses that can look similar, or they have overlapping symptoms. And my job is sometimes to figure out which one of those disorders is present, or if multiple are present at the same time, which is commonly the case. So clarifying diagnosis, and the important thing about that is we want to know, we want to be certain about what's going on with an individual so that we can develop an appropriate treatment plan. So, I like to kind of use like a medical analogy. So if somebody is having chest pain, they might go to their doctor, and that doctor will perform a medical evaluation. And that can include, different components, a physical, possibly lab work, possibly an X-ray or some sort of imaging. And then the doctor looks at all of that data to come up with a diagnosis. But more importantly, once you know what's going on and you've accurately diagnosed it, then you know how to treat it.
Yeah.
And it's the same thing for, mental health conditions and neurodevelopmental disorders. We want to know, exactly what's going on, because the treatment plan can vary significantly depending on what the diagnosis is. So
Yeah.
if an individual has anxiety, and they're presenting with symptoms of inattention, and you're thinking maybe this is ADHD, but it's actually anxiety, that's a very different treatment plan. So we want to be targeting the anxiety with therapy, potentially medication, and that would be different medication than you would use to treat something like ADHD.
Yeah. Well, and I find in my practice, I don't always need testing, but there are times where the diagnosis is hard to pinpoint, or it's several things. And so we need to kind of tease out exactly what is present. And that does help me to develop that plan of action, right? Most psychological testing comes with recommendations in the summary, right? And so that helps to hear the diagnosis, but then also developing what skills we need, right? What areas we can grow in to feel better about whatever is going on. So yeah, that makes total sense and is so helpful as a parent too, because I've had my kids tested before to help us definitively understand something, but then also as a therapist, very helpful too.
Absolutely. And I think a lot of people know this, but therapy is not just, a blanket term that you use the same skills and procedures for every client. There are different types of therapy. And I'm recommending usually some sort of evidence-based therapy that has been proven to be effective for whatever that diagnosis is.
Yeah.
So in addition to just saying, this client would benefit from therapy, I'm specifying what type of therapy I think would be the best fit for that client. And I think that can be really helpful for parents in getting some direction about how to choose from all the hundreds of therapists that are available out there, but also for the treating provider and knowing, okay, I'm going to use these skills that I have to target this particular diagnosis. So
Yeah.
but there are a lot of other reasons why somebody might seek out an evaluation. So we talked about diagnostic clarification. Sometimes somebody will self-refer just because they have always wondered, if they might have a particular diagnosis. They've noticed symptoms in themselves. Others maybe have pointed things out, or these days they might be looking at TikTok or YouTube. Some information there is credible, a lot of it is not, but they are kind of learning about themselves and wondering about kind of that process of self-exploration and knowing more about themselves. So,
Yeah.
so increasing insight and understanding of oneself is another reason why somebody might seek an evaluation. A big one that I deal with frequently in my practice is not just wanting to know if there's a diagnosis, but there are certain services and supports that are available that sometimes require a clinical diagnosis to access. So an example of that might be an elementary school student who is really struggling with reading. And the parents come to me wanting to know if the child has a learning disorder, dyslexia. And I do my testing and see what diagnosis is appropriate. And then I might be recommending like a specific intervention for them in terms of like reading remediation, but potentially even services in school. So with a diagnosis and evidence of significant functional impairment, so, difficulty learning, underachievement in terms of grades, low standardized test scores, a child might be eligible for different supports in school. And the big ones are like a 504 plan, which provides access to different accommodations or supports, or an IEP, individualized education plan, which might provide access to special education services. So maybe being pulled out of the classroom for reading or math remediation or other services in addition to some accommodations. So an evaluation can be helpful in establishing a diagnosis, gathering data about somebody's academic skills, and then parents will often take my evaluation to the school to help support that request for greater support in school. So the IEP or accommodations. Now, it's also important to mention that schools are not required to act on everything that's in my report, but they are required to consider it in their own decision making about whether a child would qualify for those services.
Yeah. It might prompt them to like look a little bit more into something to say like, this report says this. So then their psychologist, most school districts, I think, I don't know if it's required, but I mean, I think most of them have access to somebody, whether it's a member of their teacher, right? Like their population of professionals, or they have access to somebody who's an outside tester, but they do have, like, is that required? I don't know.
Yes, yes. So they do have to have somebody, I believe, access to somebody who can do testing. And many schools, especially in this area, have a school psychologist on staff who might do the same kind of testing that I can do. At least in Kansas, these school psychologists are not usually providing what we call clinical diagnoses, but they will gather information about somebody's reading skills and even administer a lot of the same tests that I administer. But they are making their decisions based on special education law, which also can vary from state to state. And so it's a little bit different. So we work together, but we speak somewhat different languages. I give clinical diagnoses and they make eligibility determinations based on, the special education law.
Yeah. So like
and
goals and those kind of things of like, we see a deficit here, we're going to put support in there. Here's what a goal is going to look like. Whereas you're saying this is dyslexia. This is the support. So it's similar. You guys are seeing the same thing, but just interpreting that part different.
Absolutely, yes. And sometimes schools will use varying criteria in order to determine if somebody has a learning disability. That's the language that they use. And sometimes that criteria doesn't always align directly with my criteria. And so there can be challenges with that, but in general, I would say that having that outside evaluation by a psychologist like myself can just be really helpful for gathering a lot of data to bring to the school to supplement what they already have there. And I also make really specific recommendations about what supports I think the child needs. And then I think a lot of times that can be helpful for the school in putting a plan in place. So
yeah, absolutely.
Yeah, so school supports, the diagnosis and the evaluation are sometimes what are needed to get over that barrier to be able to apply for different supports. Another example of that might be if somebody has a diagnosis and they're wanting to apply for accommodations on like standardized tests, like the ACT or the SAT. Those testing companies often require a recent evaluation, specific tests to be given, and they're looking for a specific pattern of results to be able to justify putting accommodations in place. So that's another reason why somebody might seek me out. Other things like government supports. If somebody has a disability and they're applying for Social Security, disability insurance, or supported living or vocational supports, a lot of times an evaluation is necessary to determine the need for those supports too. So access to supports in summary. And then there are other types of evaluations too. Sometimes an evaluation might be court ordered, or there's some sort of legal proceeding going on where an evaluation might need to be done. I don't do those types of evaluations, but there are folks who do. And a lot of them are what we call forensic psychologists. So there are a lot of us out there doing kind of different things in the assessment world. And lately my little area has been psychoeducational assessment, mostly with children, adolescents, and also adults too. I do have adults coming to me and saying, I think I have dyslexia and I think I've had it my whole life, but it's never been diagnosed. And they just kind of want to know why they've been struggling for so long. And I'm happy to do those evaluations.
Yeah. Well, and it when there's something you feel like you have this like feeling that like something's not quite right, but you can't put a finger on it, like, or a label or understanding. Sometimes labels give us understanding, right? Like it's not just about like sometimes people view diagnosing as like an excuse or something like that, but that's not really what it is. It's a way to understand ourselves and how our brains function and how we operate within the world. And so I have people in my practice sometimes who are like, I think I have autism. Or I suggest, like, have you ever thought about, autism and where that's at? And sometimes, a lot of times actually, especially when they're older, they have done their own research to start kind of like understanding this. And they're like, yes, like, I am so glad. Like, I didn't want to put any thoughts in your head, but I have felt that way. And sometimes it's relieving because it helps you to understand how you're functioning. So, like, that self exploration, but also with a diagnosis to give them that ability to like learn how to work through that or grow through that
Oh, yeah.
place.
Just having that knowledge for some people can be such a relief, because like you said, for their whole life, they've wondered why am I different? Why do I process things in such a different way from other people? What's wrong with me? And I think sometimes when they get that diagnosis or that label, then they not just understand themselves better, but understand that they actually belong to a community of other people who are just like them.
Yes.
And they have some idea about like what to do about it. So, like I said, in terms of treatment, that can be really helpful, but also just, if somebody realizes that they're scattered and they can't remember anything and their house is a mess. Oh, it's because I have ADHD. Well, then, they can turn to the literature or listen to a podcast and learn all these new strategies about how to compensate for some of the challenges that they've had their whole life. And that it's not their fault. It's not that, they're lazy or there's something wrong with them. It's that, if they have this diagnosis and that's just a part of the diagnosis. So, yeah, I do think, there are pros and cons, I think, to labeling or giving a diagnosis, but those definitely fall squarely in the pros column. And I've seen that from so many clients, both young and old. Once they get that diagnosis, it's such a relief.
Yeah. Oh, this brings us into a good next conversation, which is like, when are there times when testing is unnecessary, right? Like that we don't need it. And maybe that's also in that con place. So can you talk a little bit about that?
Yeah. So I think the big ones are sometimes people will call me and they know exactly what's going on. They'll say, I think I need an evaluation. I'm really anxious. I have generalized anxiety disorder and I'm having these issues. And so I'll talk to them a little bit. And it turns out they have already had a firm diagnosis. It doesn't sound like there's anything else going on. And what they really need is support and help, as soon as possible. The unfortunate reality of our field is that a lot of times there are wait lists for services. So, it might take a while to get into a therapist. And it certainly, unfortunately, does take a while to get in for testing sometimes because it is so in demand. So when I talk to somebody like that, I say, okay, I think you need this particular type of therapy based on what you're telling me. And you're currently not in therapy, you're not on medication. I'm going to give you the names of some folks who can provide that therapy for you and who can get you medication if you're interested. so that you can get into treatment as soon as possible, rather than waiting a while for an evaluation, having that process take, a month or sometimes more, just depending, and then finally getting a diagnosis that you already knew you had, and then waiting to get into therapy or for medication. I think it's just that wait time. I want to eliminate all of that because that person needs treatment as soon as possible so that they can feel relief for their symptoms. So, if the diagnosis is pretty certain already, what I'm doing is just directing people to supports so that they can get in as soon as possible. And then I think, sometimes the school has done a wonderful job at identifying the concern, and they have put a plan in place, and the interventions are helping. We're seeing improvement. In cases like that, I don't see a need for an evaluation unless there is some sort of concern, right? Maybe a diagnosis has been missed, or somebody's not receiving the services that they think they should be getting. An evaluation could be helpful there. But if somebody's happy and improving and their needs seem to be met, I don't think there's any need for looking further into that at that time.
Yeah. So if the school has done an evaluation and as the parent, you're feeling good, your kid's improving, your kid's feeling good, then we don't necessarily need outside testing.
Yeah, not at that time, unless
Yeah.
something new comes up, I would say.
Yeah.
Yeah. Or, they need the evaluation for something outside of school. But it's really a case by case basis. But I would say, yeah, if you know what's going on, you've got the support you need. There's no need for an evaluation at that point in time.
Yeah. Okay, good information. Okay, so when do we want to test? Because we're talking about the testing, and I heard you talk about you see people in so many different age ranges, but are there times where it's too early or too late to test?
Yeah, so I think again, it's tricky to answer that question because it's a case by case basis, depending on what the referral question is. For certain disorders or conditions, so especially on the neurodevelopmental side of things, the earlier we intervene, the better the outcomes. So that's true for autism, that's true for learning disorders. And so is it ever too early for those types of conditions? I would say no, especially for autism. And there are professionals out there who work with infants, they work with toddlers, and they are trained in identifying early signs of autism and putting those early interventions in place that are so necessary. So the earlier the intervention there, the better. In terms of specific learning disorders, we can identify who might be at risk for something like dyslexia from a very young age. So even, pre-K, we have screeners and certain tests that can say, based on a child's scores, this child is at risk for developing dyslexia. And the benefit for learning that at a very young age is that we can intensively provide those services that they need to improve their reading skills as fast as possible, so that they don't fall further and further behind by the time they get to kindergarten, first grade, second grade, right? So again, with reading, with learning disorders, the earlier the intervention, the better. Now, we might not call it a learning disorder at that first evaluation. Again, we might do those screening measures. We might say this child's at risk. We need to get them into services. And then we reevaluate after they've received intervention. How are they improving with their reading skills? Are they catching up, or are they still lagging behind and, even further and further behind their peers? After, a period of intervention, if that's still the case, then we would say, okay, intervention has not been as helpful as we thought it might be. This child is still well below peers in terms of their reading skills. At this point, we're going to call it dyslexia, and we're going to, keep hitting it hard with the reading remediation, the intervention, and putting those school supports in place. So, is it too early ever? I would say no. For something like ADHD, it can be very, very challenging to see a 4 or a 5-year-old and differentiate ADHD from the range of normal childhood behavior at that point in time, right?
Yeah.
Little kids are inattentive. Little kids are hyperactive. They're bouncing off the walls. They do things impulsively, right? They
Yeah.
don't
Yeah.
have a fully formed prefrontal cortex yet. Um, so, there are certain cases where you see a child at that age and you say, absolutely, that is ADHD, right? Some very, very clear-cut cases. And then with other kids, sometimes I'll see them and I'll say, you know what? Let's wait a little while, right? But the benefit of seeing me at that point in time is we have some baseline data. We've maybe collected some test scores about cognitive functioning. We've observed behavior and we've documented that. And now we have that to look back on maybe in a year or two to see, how has this child progressed? Has their behavior kind of become a little bit more typical compared to same age peers? Or have they continued to really struggle with focus and impulsivity and hyperactivity in a way that is now standing out from same age peers?
Yeah.
And so, as a psychologist, my whole thing is the more data we have, the better. We have multiple data points over time where we know how a child is functioning and we can track their progress. And it's so helpful for me sometimes to look back on evaluations other folks have done when a child was a toddler or a 5-year-old, and to see what their behavioral observations were of the child at that time. Oh, at that time they were noting that the child couldn't sit still throughout the evaluation and that they, were touching everything in sight. And now several years later, I'm still seeing that. So we're really establishing that history of symptoms, which is so necessary for neurodevelopmental disorders, especially.
Yeah.
So is it ever too early? No, with certain caveats. You may not get a definitive diagnosis at a young age, but you also get some information and then hopefully some direction about how to support the child at that time, regardless of whether you get a full diagnosis or not, right?
Yeah.
I'm always still saying, not sure about the ADHD, but here are some things that you all can do right now to help this child be successful, and uh, to minimize the chances that he's going to continue to struggle in the future, right? So I think, is it ever too late? I think no, it's never too late. Again, knowledge is power. We talked about how that can be so beneficial to even adults to understand themselves. And I do see a lot of parents of adolescents who are coming to me for the first time and their child has never received a diagnosis in the past, but there have always been some concerns. They just never, sought out an evaluation until the child is really struggling in middle or high school. Things are falling apart, grades are plummeting, mental health is suffering because of the challenges that the child is experiencing. And I see tons of those individuals, and more often than not, I'm hearing from their parents, I wish I would have done this sooner. There's a lot of parental guilt at that age. But, I always tell them, you're acting now. You didn't have this information when the child was younger. Nobody was directing you to do, take certain steps. You probably didn't even know that psychological evaluations existed. This is a system that can be really hard to navigate. And so I just really tell the parents, better now than never. And we can get services in place now that are going to help this child and provide them some relief so that they can be successful and happy going forward. So
well, and maybe, never too late, really. And I think, it's also, if you're, let's say, a parent age person and you're trying to find something out, maybe if it wouldn't change anything for you, right? Like if it's like, it doesn't really matter to me, maybe that's when it's like, well, maybe that's too late. But I think also understanding, I have a lot of times where a kid will be diagnosed with something, and then one of the parents or grandparent will be like, oh, I have that. Like, I definitely, now that I understand this more, I have that too. So it does, I think it still does provide understanding. I think if there's nothing we can do with it, then I get why maybe somebody would not participate in it. But if it gives us information, helps us to understand our family and our dynamic, and it's like, oh yeah, that's why school was so hard. Or, actually I have a really high intelligence, right? Like my IQ is really high, and it makes sense why I was so bored in school, right? Or it makes sense why these things have been easy, but this has been hard. And so I think it's just information is power.
Totally agree. I've had that happen so many times in my practice where I'm working with a child and then I'm asking about family history, and the parent's like, well, actually, none of us have been diagnosed, but I think dad might be on the autism spectrum. And, they're seeing signs of this. And then it's not unusual for a parent then to say, can you evaluate me too? And then
Mhm.
I'll end up evaluating the whole family.
Yeah. Well, and it
So
gives us just understanding, right? Because I think our profession is ever evolving, right? Like
uh-huh.
psychology is a young field, really. And so we're still learning so much. So even when I was in school, like what we know, like when I was an elementary school kid, I think a lot of kids were missed for things because they just said, oh, that's normal, or they'll grow out of it, or that's how boys are, or
Mhm.
she's just wired a little more anxiously, but there's actually a diagnosis to that which would open supports. But we've learned so much. And so since our profession is growing, those parents now would meet the qualifications because we know more. And so that would be maybe relieving to them too.
Very much so. Very much so. Um, yeah, and even how we diagnose things has changed so much over the years. In my career, the diagnosis of autism has changed twice, in the last 10 to 15 years. So, a lot of folks are falling underneath that umbrella now that didn't before. And we're learning more and more about how autism presents differently and in women versus men.
Hmm.
And this field, like you said, it's constantly evolving. And and I think, like I said, it can be really helpful for those adults who are now getting that better understanding of themselves. And usually what happens in conditions that are not identified, or when folks have been struggling for decades and decades and decades, is we see a high rate of mental illness in those individuals. So they've maybe developed depression or anxiety because of their difficulties functioning in this world that we live in.
Hmm.
And without the label or the understanding, they feel a lot of self-blame, or others have labeled them in other ways that aren't helpful.
Hmm.
And so it can just be so beneficial for somebody to understand themselves better.
Yeah, and it improves relationships, right? Like there's just so much that can be improved from that.
For somebody's spouse, why is he the way he is? I think, oh, like now I understand why he does these things that
Hmm.
I just have not been able to understand this whole time. Relationships definitely improve. And I will also just say that these neurodevelopmental disorders like autism and ADHD and specific learning disorders, they're highly heritable. So they are genetic and they tend to run in families.
Hmm.
It's not a guarantee, obviously, that if a parent has autism, that their child will, but the probability of that happening is so much higher when there is a neurodevelopmental disorder in the family.
Yeah.
And they are also highly comorbid with one another. So when you have one neurodevelopmental disorder, it's probable that you will have multiple. So somebody might have a learning disorder and ADHD,
Hmm.
or autism and ADHD.
Yeah.
Um,
It's good for us to be on the lookout and just like have an awareness that us struggling with something just because we provide our kids supports and they live in a great school district or whatever they're getting, that doesn't mean that, because these are genetic, right? So these are things that we're born with. It's not like that part is the only piece of the puzzle is having good supports in place. if you have dyslexia, even if you have good support, sometimes you still need to have ongoing support. It's not just like a one-time deal. Or if you have ADHD, you take medicine one time, that doesn't, let's say, cure ADHD, right? It's an ongoing thing that we're managing, right? And sometimes medication isn't the best choice for every family, but if you find out what supports could be in place, then you can implement a lot of different things to like have a more positive environment.
Absolutely. And I think you just made a really good point there that even if two people have the same diagnosis, their needs and their treatment plan might be somewhat different, just depending on, what their particular level of functioning is, the family values, what they want to seek out in terms of treatment. And an individual's treatment plan will change throughout their life, depending on what their needs are at any particular point in time. So, an individual might be on ADHD medication in childhood, but then in adulthood, they decide, I want to try without it. And,
Sure.
they'll put some compensatory strategies in place to, manage how to remember things, how to stay organized, and they can figure out how to function without the medication. So, and, reading intervention is really, really essential for kids at an early age who have dyslexia and even, into their teen years. But as they enter college and adulthood, there might be just ways that they kind of compensate for the dyslexia. So they might say, I'm going to use text to speech technology or audiobooks. And they use those at work and are able to function, at the same level as neurotypical peers.
Yeah.
So
That's a good
uh,
point that you made, Lauren, about that. Of like, you could be an adult who feels like maybe your job requires a lot of reading, and you also maybe have dyslexia but don't know it. And then being diagnosed, then that might open up this door for your employer to provide these things. So, like, if you have to read a lot, they then could have that knowledge to say, oh, we'll provide a software that does read your emails to you so that you're making sure that you're not missing data, or that you can have audiobooks on the things that we need you to consume, or having certain types of training if your job requires continuing education. And so that could also be an important time. So like, you may not be able to get the same supports as a 6-year-old diagnosed with dyslexia, but as a 46-year-old, you could also get accommodations at work. And I think a lot of times people don't think about that piece. It's like the accommodations are only for school, but they can also be for the workplace with the ADA.
absolutely, yep. With a diagnosed disability and the appropriate documentation, workplaces are, required to provide reasonable accommodations. So,
And
uh,
psychological testing can do that for you, correct?
yeah,
Okay.
absolutely.
Okay,
Yes.
cool. Okay, so sometimes I get this question in my practice where parents will be like, I'm apprehensive to get psychological testing because they're just going to find something wrong with my kid, right? Like they're going to just name something to name something. What do you feel like that's true? And do you ever tell people that they don't need testing? Like, what are your thoughts on this?
Hmm. Well, I can only speak for myself because, there are a lot of psychologists out there, but in my practice, I am not looking to diagnose or label anything that's not there. So I try to take a very conservative approach. And like I said, sometimes I end up saying, this is something I'm considering, but I'm not 100% on it right now. Let's wait and see, and then reevaluate in a few years. So that's not uncommon. I also have cases where somebody comes to me with a question or a concern. We have an initial consultation where I do an interview and gather information. And, it just really does not sound like there's a diagnosis there. There's
Mhm.
no reason to put somebody through the whole process of testing plus the expense of it. And I'll say, I hear you're struggling with this. And I don't think it's diagnostic, but I can
Mhm.
tell you're struggling. And so here are some things that you can try to help with that particular concern or the symptoms that you're experiencing. So my tendency is not to look for labels or to diagnose anything that's not there because I don't
Mhm.
think that's beneficial.
Sure.
So So, and then in terms of, parents being on the fence about, well, what if I do an evaluation? What if there is a diagnosis? I think obviously that can be, a very weighted thing. It can be very scary for a lot of parents to kind of have that confirmation of maybe something that they've always been suspecting or even worried about. But in certain cases, they're really hoping that that's not true, right?
Mm-hmm.
And so, what I find is that in my evaluation process, I tend to be very transparent with folks. And so, we're doing an interview at first. I'm hearing some things that could be indicative of a particular diagnosis. And I'm saying, have you ever considered XYZ diagnosis? Has that ever crossed your mind, or has anybody ever brought that up? And a lot of times the parents will say yes, even though they hadn't mentioned it already.
Mm-hmm.
Sometimes they'll say no, and because they don't really know much about that particular
Sure.
diagnosis. And so I might share, this. I'm thinking this because of what you've told me. These few symptoms could be red flags for this particular diagnosis. Would you be open to looking into that further?
Mm-hmm.
Right?
Mm-hmm.
Sometimes I have parents who say, absolutely not. I don't want to open that door and I don't want to assess for that. And I'm not going to do that without parental consent. So I might leave it at that. But I've also planted a little seed, right?
Mm-hmm.
And maybe a few years later, the parent says, you told me that a couple years ago. Since then, we've been seeing these other things, and now I'm ready to look into that. And that's
Sure.
okay. It's
Yeah.
okay. So then as we're going through the evaluation process, we're collecting data through testing. I'm usually giving a little bit of feedback. I try not to give a firm diagnosis before all the data has been collected, but this is a process and we're having conversations along the way. And over the course of the evaluation, the parent might be saying, you mentioned that thing, and now come to think of it, I've been watching my child and I've noticed all this stuff, and I never knew that that could be related to this diagnosis, but is that relevant? And so collecting data, I'm observing the child, I'm giving the parents some feedback along the way. By the time we get to the end of the process, the feedback session, my goal is for there to not be any surprises, right? If there's a surprise, and the parent, something comes in out of left field and the parent's like, whoa, this was not even on the table. I haven't done my job well. And I will say that that's never happened in my practice because of us having this open line of communication all along. So usually by the feedback session, the parents are in agreement with the findings. They say, yes, this fits my child. This is what I've been seeing all along. And now we have the data and the numbers to support what I've been seeing. Sometimes I will have that parent who, again, has kind of been dreading that potential diagnosis. And then we have a really, frank process conversation about, how are you feeling about this? And any way that you're feeling about it is okay, right?
Yeah.
It's totally normal for a parent to feel like, yes, it fits, and it's still really hard to hear. And they're wondering, what does that mean for my child's future? And they're having to kind of recalibrate, their vision for the future and their expectations for the child. And so that's a process too. And that's not something that they can necessarily come to terms within like that hour feedback session.
Sure.
But
Yeah. Well, and I think, I was just going to say to that, there's like a grief process, right? To that recalibration of like,
yes.
even if we just naturally have hopes and dreams for our kids. And so then, they're born and they're this tiny baby, or they come home to us and they're this tiny baby or the toddler or whenever, if we're adopting, and we have ideas of what life is going to be like. And then when something happens that changes that part, it can be really hard. And I think we have to give ourselves grace of like, we don't have to process this part with our kids right now. And it might be something that you have a conversation with later in their life when they're an adult, because they're going to go through having kids, and you talk about like the process of them getting diagnosed with autism or something, of like, this is how it felt, but we've done a lot of work since then, right? And they're in a great place, but like, giving that permission to just process through it. But like with a trusted person, sometimes a therapist is a good place for that parent to go to get that feedback to say, this is okay. Like we can get through this. You are strong enough to handle this, and your kid is gonna, like, we're gonna get through this. And let's get supports in place. Because if we have a village to help us raise our kids, then it is so much easier and it's so important. And that doesn't mean anything's bad or wrong. It's just like good to have the sports to have your kid be happy and healthy and successful, whatever that definition of success is.
Exactly. Yep. So let's recalibrate our kind of understanding of our child, but get to work and, implement everything that we need to make sure that they can be as happy and successful as possible. That label doesn't change anything about your child. Your child is still the same child they were yesterday before they had the label. So they still have all those wonderful strengths that they've always had. And they do have these areas that are challenging for them, which is what you already knew. It's why you came in to see me.
Yeah.
But now we have a plan about how to address those challenges. So, your child can flourish. So, but you're right, it is a grieving process. And I think it does take a little while for a parent to kind of wrap their mind around, okay, now I understand what's going on and what we have to do about it. And all of those emotions are completely normal and acceptable. So
yeah. Well, and I sometimes find people on the total opposite side where they're like, yes, like I knew this is what it was. Like I knew this was the diagnosis. And even though those things are still hard, they're just elated that we have it because now we can do something about it. So like there's both sides, and people can fall in such a spectrum of emotion from that. But I think it is all helpful. So something I was going to recap that you were kind of saying is like, just like any profession, there are people who are really good at their job. And then there are people that have the same degree, but maybe are not as good at their job. Not that you said that, but like there are tests that I have seen, psychological testing or educational evaluations or assessment, right? And the report is really comprehensive and it covers the numbers and it gives us recommendations. And so maybe that's also what parents look for, is like maybe it's asking people for referrals, like a pediatrician or a therapist or another family that has gone through testing. Like, how was your experience? So finding a referral that is trusted by somebody else. And then you can ask questions. And also, like, I think observing the way you feel with that person talking to you. So if you call and you're like, I did not connect to that person, and like, I don't feel like they care, or I'm not loving this energy, right? Or you go and you feel like they just don't get it. You don't have to keep going with that person. Find somebody else that makes sense, because I do think when I get a 2-page report as a therapist, I am not happy with that. Right. Like I love unless there's nothing to be found, right? Like that would be a different story. But if we have diagnoses, I want it to be comprehensive. I want to see the numbers. I want to see how we're validating this diagnosis and the recommendations and the family history and just hearing the whole picture together. And that's what I think is a good report, because it is something that anybody could read and then understand the whole part. There's no questions. And so I would just encourage parents also to be okay with, if you start a process with somebody and you're not loving it and you don't feel like they're a good fit, don't just say, we're going to find somebody else, or like, I didn't feel like this was the right fit, or we're going to try a different psychologist. And that is okay. Please do.
Totally agree. I mean, I don't think it matters what kind of provider you're working with, whether it's a medical doctor, a therapist, or a psychologist for an evaluation. Fit is so important. And if you just don't get a good feeling from it, or you don't connect on a personality level, it is perfectly fine to say, I'm going to stop this process and find somebody else. You should never feel like you're stuck with a provider that you don't feel comfortable with.
Yeah, absolutely. And then another thing I wanted to say is, so the testing, and you can speak to this better than I can, but all of the testing that we do is empirically supported. So that means other people have reproduced the results that we get over and over and over again, in order for us to say this assessment pretty definitively affirms or denies a diagnosis, right? So when you're doing testing, it's not like just your opinion. It's also these measures that have been researched and supported, and then supported by other people that aren't the people that came up with it. Is that right?
Absolutely. And I'm so glad you brought that up, because I wanted to talk about what an assessment looks like. I don't know that I've I've gone into that, but there are so many parts to a comprehensive psychological evaluation or assessment. And as a psychologist, I don't depend on any one score or test or piece of data to make a diagnosis. So somebody will call me and come in for an evaluation. Like I said, I start with a clinical interview, and that is a really thorough with me. Usually about 2 hours sometimes interview where we are reviewing all the information about a patient's history. So we're going through, how was the mother's pregnancy, all the way up to the present day, and looking at all the different areas of functioning. So developmental functioning, did they meet their milestones, academic functioning throughout their life, social functioning, emotional functioning, behavioral functioning, really comprehensive look at, what's been going on with this individual and any concerns that have been noted along the way. I'm also reviewing records. So I'm looking at report cards. I'm looking at reports from previous evaluations that have been done by different types of providers, maybe an occupational therapy evaluation or speech or another psychologist evaluation. I am getting corroborating data. So usually a parent's bringing a child in, so I will be asking the parent about their observations of the child. I'm talking to the child too, and getting to know them. And I'm also seeking outside information, maybe from teachers that have been working with the child, and getting everybody's thoughts and observations. And then during the actual testing process, so after that initial consultation where I'm doing the interview, I might bring somebody back in if I think it's worth doing additional testing. And they'll meet with me in my office, and we will do what are called objective measures. So these are norm reference actual tests of different skills. So we might be looking at cognitive processing with something like an IQ test, looking at different cognitive strengths and weaknesses. We might be looking at attentional skills, executive functioning skills. We might be looking at academic achievements, so reading, writing, math, spelling. And there are actual tests where, like you said, thousands and thousands of individuals that child's age have taken those tests, and we have a general idea of how people score, so we can compare that child's performance to those thousands of other individuals and figure out, what percentile is this child in on that particular skill area, and does that fall, well enough below average that we might have some sort of disability or disorder here. So again, we're looking at those scores. These are scientific, objective tests of cognitive functioning, right? But then we're also looking at subjective data. So those are our rating scales. So maybe questionnaires looking at symptoms of ADHD or anxiety, or a really broad-based questionnaire that looks at a lot of different areas of an individual's functioning. And depending on the child's age, they might rate themselves on that. We certainly get parent ratings and then teacher ratings too, and kind of looking at how all that data converges and what patterns are emerging from that. And then in addition to all of that, I'm gathering my behavioral observations. So as I'm working with the child, I'm watching them, I'm taking notes, I'm seeing what their social skills are like. Are they able to sit through a session? Do they need to stand a lot or move around? Are they starting on tasks before I tell them to, impulsivity? So I am gathering a wealth of data from just sitting with the child and working with them. And then after all of that data is gathered, it's my job to, again, look at those patterns, put it all together, analyze it, and see, does this point to any particular diagnosis based on the criteria in our diagnostic manual. And so, yes, this is a scientific process. And there is also some clinical experience that's necessary to kind of tie it all together. And that's where, my training and my expertise and analyzing the data comes in. Could two psychologists look at the same set of data and arrive at different diagnostic opinions? Yes, and it happens all the time. So while it is scientific, there is some clinical judgment that also comes in. And, you know, I just wanted to mention that as a possibility too. So, like
Well,
you
and
said,
maybe it's also like you have a specialty of like what you see all the time. So maybe it's also that piece of like maybe somebody is really an expert at autism, but that's not what you're looking at for your kid. That doesn't really fit the place that you're looking for. You're looking for dyslexia. And so maybe it's also asking that practitioner, how experienced are you with this particular diagnosis? Is this something you see a lot? So like being curious about that person's experience with what you're looking to rule in or out
mhm,
for your child. So I think those things are important too, because if they do mostly personality disorders, they may not be the best fit for diagnosing dyslexia. Or if they are somebody who does lots of court testing, that's not, the educational testing realm is probably not their forte. And so like finding somebody who really does the testing that you're looking for, and even if a friend use them but they're looking at something else, they may not be the best fit for you even though they really did like them. So I think it's so yes, somebody could find a diagnosis that's not there, but you also have like all these measures, and should be validating why they think that based on all the information together. So it seems unlikely that they would just come up with a diagnosis because of you paying them money to do testing. It's more
mhm.
that there is data to support observationally, um, from parents, teachers, like the support systems, but then also the data that you're doing, the actual testing, that's the psychological testing to support all the things together,
That's right.
right?
Yeah,
Okay.
that's right. Absolutely.
Okay. That's a lot of information. We covered so many things.
Yeah.
I want to ask what you want parents to take away, but is there anything that we have missed that you feel like is a good data point for parents to hear about?
Honestly, I can't think of anything that we've necessarily missed in this session. Obviously, this field is so broad and there's so
Yeah.
many things that we could dive into more deeply. But in terms of take-home points for parents, I think just to kind of summarize what we've talked about, if you have a concern or a question about your child, it is never too early or too late to seek out more information.
Yeah.
And, more information can be scary to gather, but it can also be so life-changing and helpful. And usually, the sooner you gather that information, the better, because you can get the intervention, the support, the treatment that you need. And we can make life easier and better for that child or adult as soon as possible.
Yeah.
So those are my takeaways. Also, personally, like I said, this field is very difficult to navigate. And I do a lot of like phone calls that I'm not charging for, but parents will call me and they'll say, "Hey, what do you think? Is this worth having an evaluation for? Do you think we should wait? Should we just go right to therapy?" And I am really happy to help people along this path and kind of guiding them about what the appropriate next step is, because there really aren't a lot of people out there doing that or with knowledge of this system to be able to give that advice. So if you even have a question about whether an evaluation would be helpful, call a psychologist and ask them that question. Hopefully they'll be able to provide some guidance on that.
Yeah, absolutely. I think getting curious, right? Like if you see something that you don't understand, right? Or you feel like there's more to be had there, get curious about it. And including testing could be the best next step. So thank you so much for being here today. I like so much good information. I think families will really appreciate this. So thank you so much for your time.
Thank you for having me, Bryce.
Yeah, absolutely. Thanks again, Lauren, for all that amazing information. I know that was a lot of data, but it was really helpful for me to think through all the pieces about why psychological testing can be so important. And when we would access that service, I think psychological testing or the world of psychology is kind of confusing sometimes. And so I'm glad that Dr. Spears was here to help us break that down. If you like what we're doing, please subscribe to our show and give us a rating. If you have episodes that you would like us to cover, please email us at accidentalexperts@gmail.com. Follow us on Facebook and Instagram and YouTube. Looking forward to seeing you next week. Have a fantastic day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.